Welcome to our next session. Today we're going to be looking at the neurovascular assessment to the lower limb. It's absolutely crucial to perform a thorough neurovascular assessment when assessing patients with lower limb orthopedic injuries, as fractures and dislocations can readily disrupt the neurovascular supply and therefore make the management of these injuries much more urgent. Let's start off with the vascular supply to begin with. There are two key pulses that we want to feel when assessing the vascular supply to the foot. These are the dorsalis pedis and the posterior tibial. Of course, we're going to be starting our vascular assessment of the lower limb by first looking to see if there are any signs of acute vascular compromise, such as a pale foot and a cool foot as well. But moving on to the palpation of these, if we first take the dorsalis pedis pulse, we'll draw a picture of the dorsal surface of the foot, where this is the medial side, this is the lateral side, and we'd find the dorsalis pedis pulse in the first intermetatarsal space. So if this is the great toe, we're going to find the dorsalis pedis pulse between the first and the second metatarsal. It also runs just lateral to the extensor hallucis longus tendon. So palpating over here, we get an indication of whether we can feel the dorsalis pedis pulse. This is a continuation of the anterior tibial artery. Let's take a look now at the posterior tibial pulse. If we look at a side-on or a lateral view of the foot and ankle, we can see we'd have the medial malleolus round about here, and we'd have our Achilles tendon inserting onto our calcaneus. The posterior tibial pulse runs at a point halfway between the medial malleolus and the insertion of the Achilles tendon. So halfway between this point is where we'd feel for the posterior tibial pulse. This is also known as Pimenter's point. So placing our fingers behind the medial malleolus, midway between that and the insertion of the Achilles tendon. Now, of course, we want to feel the cap refill just like we would in the upper limb as well. And therefore, we'd squeeze on the nail bed of the big toe or any of the toes and count how long it takes for capillary perfusion to return to the capillary beds that we have emptied. 2 to 3 seconds is normal, and any further is abnormal or delayed. So now we've gone through the vascular supply, let's have a look at the sensory and motor to the lower limb. The foot is supplied by 3 peripheral nerves. These are the common peroneal nerve, which has a deep and superficial branch, and a tibial nerve. All 3 of these are from the sciatic nerve, which branches just distal to the knee. So let's have a look at the dorsal and so that's the dorsal or upper surface of the foot, and here we have the plantar or bottom or sole of the foot. So looking at our sensory supply, let's start off with the common peroneal nerve. Now this supplies the upper side or the dorsal surface of the foot, and therefore when testing the common peroneal nerve, this is the area that needs to be tested for sensation. Now it's split into 2 areas. The first area is the vast majority of the upper side of the foot or the dorsal surface. This is supplied by the superficial branch of the common peroneal nerve. The deep branch of the common peroneal nerve supplies a very specific place, the first dorsal web space. So that's the deep branch of the common peroneal nerve. Looking at the underside or the plantar aspect of the foot, the tibial nerve is responsible for supplying the vast majority of the supply to this. It's worth noting that there are two key areas which are not supplied by the tibial nerve exclusively. Just on the medial aspect over here, the saphenous nerve gives supply, and over just the lateral surface over here, the sural nerve. Now the saphenous nerve is the largest sensory branch of the femoral nerve, and therefore this would of course not be testing the tibial nerve sensation. The sural nerve is a sensory supply which takes branches from the tibial and the peroneal nerves, and therefore you cannot be certain that you're exclusively testing tibial nerve territory when palpating over here. And therefore, if you want to ensure that you're exclusively testing the tibial nerve, the vast majority of the plantar aspect of the foot would be in keeping with this. So we've gone through the sensory supply to the foot for the peripheral nerves. Now let's have a look at each of these peripheral nerves and what they do in terms of their motor function. So starting first with the superficial branch of the common peroneal nerve. This supplies the lateral compartment of the leg. This includes the peroneus longus and brevis, and these are everters of the foot. So therefore, the superficial branch of the common peroneal nerve will evert the foot. To test this, you need to ask the patient to bring the lateral aspect of their foot pointed upwards or towards their lateral malleolus, and test this against resistance. Looking at the deep branch of the common peroneal nerve, this supplies the anterior compartment of the leg. These are the dorsiflexors of the foot and include muscles such as tibialis anterior and extensor hallucis longus. So, testing this nerve, we would ask the patient to dorsiflex their ankle and hold it there while we test their power against resistance. Finally, the tibial nerve supplies the posterior compartments, superficial and deep, to the leg, and therefore this supplies the plantar flexors, or the flexors of the ankle. These include tibialis posterior, flexor hallucis longus, and flexor digitorum longus. And therefore, to test this nerve, we'd ask the patient to plantar flex or point their toes down while we test this against resistance. So, just to summarise, to test the neurovascular assessment of the peripheral nerves to the foot and the lower limb, we'd first want to test the dorsalis pedis pulse, the posterior tibial pulse, and also the capillary refill time, as well as looking at the lower limb to look for any signs of acute vascular compromise. Moving on to the neurological assessment of the peripheral nerves to the foot, we can see that we have three nerves, the superficial and deep branch of the common peroneal nerve and the tibial nerve. The deep branch of the common peroneal nerve supplies sensation to the first dorsal web space, as well as dorsiflexion of the ankle in terms of its motor function. The superficial branch of the common peroneal nerve supplies sensation to the vast majority of the dorsal aspect or upper aspect of the foot, as well as eversion of the ankle. And finally, the tibial nerve supplies the vast majority of sensation to the sole of the foot, except for these two parts, medially and laterally, as well as plantar flexion of the ankle, or pointing the toes down. I hope you found that useful. Please feel free to message below for any further ideas of teaching that you would like. I look forward to seeing you on the next video. Thank you very much.